Melanoma can be very easy to diagnose, can be very hard. It has different clinical presentation. The trick that we tell the population all the time, we keep repeating to help self-exam, to help self-diagnose of skin cancer is A, B, C, D, E. This is easy. We repeat that. It's in the media. It's in the Vancouver Sun. It's in the USA Today. It's every year when we do the campaign. A, we look at your skin. Everybody has mole. Everybody has a brown spot on the skin. But if you have one that is asymmetric, the borders is irregular, you have black color. Melanoma is black. Melanoma is multiple colors, so black, brown, red. When it's bigger than 6 millimeter, and especially if it changes, I usually tell my patient, listen to your wife, listen to your significant person in your family, because if they see something changing on you, you better see your dermatologist or your doctor. A, B, C, D, E. This is a man in his 50s, 60s that has a lot of brown spot. That's a problem. When you look at yourself, you have many brown spots, but you have to recognize the one that is dangerous. He has a big, on the upper back, he has a big verrucous lesion we call keratosis. It's benign, but on the mid back, you see a melanoma. It has all the signs, A, B, C, D, asymmetry, irregular border. The color is terrible, black, gray, red, brown, and it's big, it's 2 centimeters. And if you speak to his wife, she's gonna tell you that it changed. So A, B, C, D, E, see your doctor, that's melanoma. So melanoma arises usually in around 50 years old. That's the main age. We see melanoma in the 30s. So another trick we tell the population, if you look at yourself and you have many lesions on your back and you have one that is bigger, more suspicious, like this one, this is a sign you should see your dermatologist. Legs. Legs of women is a place for melanoma. This is a leg of a woman with, again, a suspicious lesion. You see that it's not as obvious as the man on the back, but this is too much. It's asymmetric. The border is irregular. The color is not even, and it's large. So this is an early melanoma on the leg of a woman. Women have melanoma more on the legs and arms, and men more on the back because they go undressed naked with the trunk naked. You can have melanoma everywhere. We even have melanoma sometimes in the mouth, on the eye, on the genitals. But here we have a melanoma on the face. This is a melanoma associated with prolonged exposure to the sun. And again, if you recognize the sign, it's not normal to have a brown spot like this on the face that is irregular, that big, and many colors. So this is melanoma on the face. So I show you this patient because it is a very important patient for me. I never saw this patient before. I was following his sister for years. And one day she didn't come to the office because she was swimming with him during the summertime in the pool, and she noticed that. And since she was well aware of the ABCD, she said, go and see Dr. Claveau, and she picked the melanoma. So this is to tell you that the population is important. The exam that you do to your family members is important. And in that case, she saved the life of her brother. Now, dermatologists, we have a new tool to diagnose melanoma. This is called dermoscopy. So this is a special magnifying glass that is helping us to diagnose more precisely the early cases of melanoma. Just to show you that when you have a suspicious lesion, you go and see your doctor, and either the family doctor, the surgeon, or the dermatologist will proceed to biopsy, and this will be sent to pathology. Pathologists are very important in the diagnosis of melanoma. In Canada, we are very fortunate to have a big group of pathologists to help with us to make the diagnosis. Of course, again, we have a shortage of many specialists, so we need more well-trained pathologists because it's not easy. But this is just to point the importance of pathology. So this is just to tell you, without going too much in detail, that melanoma, the thicker it is, on the right side, you see level 5. This is a melanoma which is deeper. This is a melanoma that has more chance to spread elsewhere on the system. If you go more toward the left, stage level 1 or 2, you have a high risk of to cure the patient, high rate of cure. So the thicker the melanoma is, the worse it is. That's why it's important to do an event like today to increase the awareness about melanoma, so we have more melanoma to remove early and we have less severe cases